I'm Dr. Leslie Gray, Dermatology Center of Atlanta, and I'm joined by Dr. Kristin Magee, who many of you know. And every October we celebrate you, our amazing DCA patients, with our Customer Appreciation Night and all the events that kind of come with it. And it's our way of just saying thank you. We are honored that you choose us for your care. We appreciate your referrals, and really you're just part of the best patient community any practice could ask for. So I want to thank you for that. We love seeing you all, and we hope you can join us for all the Customer Appreciation Night fun that's coming up. In addition, it is our anniversary month. We're celebrating 23 years this month. And also, as many of you know, it is Breast Cancer Awareness Month in October. And this year it is very personally relevant to me. As many of you know, I was diagnosed with breast cancer in early March, and it has been a battle. I am incredibly grateful, though, for the outpouring of support that I've gotten from the cards and the gifts and just the words of support, and especially the prayers have been incredibly meaningful to me, and I can't thank you enough. And this is why I, again, say our DCA family is absolutely the best, and it feels so good to just know you have that support behind you. I'm happy to report I am almost done and will be successfully ending my treatment pretty soon, and am currently cancer-free, which is yay, great. And in addition to myself and several Dermatology Center of Atlanta staff members, Dr. Magee is also a coming up on now 4-year cancer-free survivor of breast cancer, and she's been my go-to person. It has been great to be able to go through this process and actually have someone that you know that has gone through it, and she's been a wealth of information, support, just watching her do her thing and just doing so well, thriving. It was inspiring for me, so thank you for all that. And
thank you for supporting me.
And interestingly, we both had a kind of rare subtype of breast cancer called triple negative. And triple negative is only in about 10 to 20% of breast cancers. It's called that because there's 3 receptors they look for in breast cancer, and if you have one of them, you can have these targeted therapies, and unfortunately triple negative has none, so just a little bit more difficult to treat. But in honor of Breast Cancer Awareness Month, we decided to turn our negative into a positive, and we are going to just share a little bit about our stories, and also tell you a little bit soon about this Pretty in Pink Raffle prize that you can win. The proceeds of this prize are going to support the Breast Cancer Research Foundation, which is a great foundation. It's actually the largest private funder of breast cancer research in the world, and currently they dedicate 25% of their total investment to triple negative research. So, awesome. So meaningful for us, and hopefully meaningful for you all too. So Kristin, you and I discovered our breast cancer different ways.
Yes.
Yeah.
My gynecologist felt my lump when I went in for my regular check. Honestly, my breast exam was baseline hard. It felt lumpy, bumpy. It was hard to tell what was what, but once she pointed it out, I could feel it. And then luckily I had scheduled that appointment on time, and I had my mammogram scheduled a couple days later. So I was pretty shocked when I found out. I felt like I was young at 42 and healthy and no family history. I was sad, I was stunned, I was shocked, but I also felt very surrounded by love from my family and all my family here. So, how about you?
Yeah, so mine was interesting. So yours was on your gynecologist and something you felt, and mine was just my mammogram. I had actually the year before I had a biopsy of a benign lesion. It was my first biopsy, and because I had the biopsy, 6 months later they just checked the spot. And then 6 months later and it was normal, and then 6 months later was my normal routine mammogram, and in a different area they found the cancer, and I could not feel mine. It actually took about 2 or 3 days. I knew where it was, I knew where the biopsy was, but until I could actually feel it. So sometimes it is something you can feel, sometimes it's not, so it's important to get your exams. And many of you can relate to this. I know a lot of you guys have family members or maybe loved ones who have had breast cancer. Maybe you yourself are a breast cancer survivor.
Because it's so common. Breast cancer is the 2nd most common cancer in the United States, only behind skin cancer. So just like we encourage you to really be aware of what's going on with your skin, same thing, you want to be aware of what's happening for women to do their breast exams. And if you have a challenging exam, it's hard for you to know which mole is the problem, which lump is the problem. Ask your healthcare provider for assistance and schedule your exams.
Yes, and do the self-exams monthly for both your skin and your breasts. And so just a couple quick facts about breast cancer. Right now in the U.S., 1 in 8 women will develop breast cancer in their lifetime. That is 13% of the population, and that is a lot.
Every 2 minutes, a woman is diagnosed with breast cancer in the United States.
Yeah, and 15% of women diagnosed have a family history of breast cancer, and if you have a first-degree relative with a diagnosis of breast cancer, you're nearly twice as likely to develop breast cancer yourself, which was my case, but not yours.
Yeah, so the flip of that statistic is 85% don't have a family history.
Right.
But fortunately, most breast cancer cases, 64%, are diagnosed at a localized stage, which both Dr. Gray and I were so fortunate to have ours diagnosed then, because the treatment is typically easier, and we were very lucky.
Very lucky. And so in honor of Breast Cancer Awareness Month, for the survivors, for those who lost their battle, for the newly diagnosed, we are having a very special raffle. So this is our Pretty in Pink basket. It is a cute little basket with a cute little mug, and it is jam-packed with goodies. We've got tons of little procedures in there, from Botox to cool tone to hydrofacials. There's a $500 gift certificate to the Advanced Skincare store. There's just products in there as well thrown in. It's over $2,000 worth of fun stuff in here just for you. The raffle tickets are just $5. If you purchase 5, you get 1 free. And 100% of our proceeds are going to the Breast Cancer Research Foundation. You can purchase your tickets online at the on the Advanced Skincare store. The winner will be announced at our Customer Appreciation Night, which we certainly hope you can join us at. We will both be there. And you don't have to be present to win. We will get in contact with you, so enter as much as you can. Share and share the links with your friends and family. Thanks so much, and we hope to see you at Customer Appreciation Night.
See you there.
Bye.